Now let's go over Overjet and Overbite. The reason we care about this is because it gives us a lot of information about the relationship between the mandible, or the lower jaw, and the maxilla, the upper jaw. An excessive overbite or overjet can indicate insufficient growth of the mandible. It can also give information about positioning of the mandible in relation to the maxilla. So it could mean that the mandible is sitting backward or posterior to where we would want it for an efficient relationship with the upper jaw or the maxilla. And this can bring us back to oral posture and oral movement, which is why we're assessing it for myofunctional therapy. Okay, so if you're doing this on yourself, you'll just look in the mirror. If you were doing this on your child, I'd have them lie on their back just to standardize things and to make it easier for you to actually see inside their mouth. We are going to be looking at the relationship between the upper or maxillary incisors, the 4 central teeth here, and the lower incisors of the mandible or the lower jaw, the central teeth here. Okay, so for an overjet, what we're looking for, if this is the front, you're looking straight that way. These are your top teeth, the incisors, and your bottom teeth. You want to first assess for an overjet, which is going to be the relationship between your teeth, your upper teeth here and your lower teeth here. So in the horizontal plane, you want to see the distance between the teeth. Ideal or normal is about 3 millimeters. If you see more than that, you want to note that on your self-assessment form if you're following along. Okay. And then we want to look for overbite, which is going to be, again, central incisors, you're looking that way. Lower incisors, you want to now look at the overlap in the vertical plane. So this is going to be overbite. Normal is about 2 to 3 millimeters once again. So if you're seeing more than 3 millimeters and you're seeing potentially even that your bottom incisors are almost completely covered by your upper incisors, you want to note this on your self-assessment form because this is something that is atypical and something we'd want to address. If you have any questions with overbite or overjet, please write it in the comments section below, or you can find me at summerspt.com, or you can reach out to your local myofunctional therapist. And if you'd like a self-assessment form to follow along as you click through these videos, you can click the link below and enter your email address, and a full myofunctional therapy assessment form will be emailed to you so that you can follow along.